Hi, this is Riyas. This is Paraminical Genesis. Today in this video, we will discuss about the what muscle relaxant did the neuromuscular junction. In previous video, we will learn about the greater physiology behind the neuromuscular junction. Before start the video, you should watch the previous video, then come back this video. Then only you understand this whole concept of this thing. Okay. Today we will discuss about what muscle relaxant did in neuromuscular junction. Okay. First, we should learn about the what is the classification of muscle relaxant. Okay. Muscle relaxant is majorly divided into two different types. Okay. First one, depolarizing. Depolarizing muscle relaxants. And another one is non-depolarizing muscle relaxant. The classical example of depolarizing muscle relaxant is nothing but succinylcholine. Okay. And the non-depolarizing muscle relaxant is further divided into, according to the chemical structure, it's further divided into benzoisoquinone and the steroid compound. And depends upon the duration of action. There is a long-acting muscle relaxant, intermediate and short-acting muscle relaxant also there. So now we classify according to the chemical structure the benzoisoquinone and steroid. How the example is atracurium, mevacurium, and this is atracurium. Okay, and the steroid combo example is Vecuronium, Pacronium, Rocuronium, and so on. Okay. So this is the majorly divided classification of the muscle relaxant. And we should know about another thing also, that is the reversal agent. The reversal agent is nothing but reverse the muscle relaxation. Okay. The commonly used muscle reversal agent is Neostigmine. It is a anti-acetylcholine stress. Later we will know about the physiology behind mechanism of action behavior. Okay. Second one is Sugammadex. Okay. That is a gamma destructive compound. Okay. So this is the classification of muscle relaxant and reversal agent. Then we will go back to the what will happen in the neuromuscular junction in during the anesthesia using of muscle relaxant. Okay. So first we will discuss about the what depolarizing muscle relaxant did in the neuromuscular junction. Depolarization muscle relaxants promise into different way of muscle relaxation. Okay, so depolarizing muscle relaxant. Two different ways. That is a phase 1 block. So second is phase 2 block. So first we will discuss about the mechanism of action on the phase 1 block. Okay. So assume this is a muscle that is the no terminal and the muscle end plate is there. Okay, muscle end plate. Okay. So there is a receptor present in the synapse that is called acetylcholine receptor is there. Okay, and the molecule also there, that is acetylcholine is trace. Okay, so that is a rough diagram of the neuromuscular junction. So do we use up this acetylcholine, that is a depolarizing muscle relaxant. Then the acetylcholine comes and binds in acetylcholine receptors. Okay. After mice, it produce antipolarization, so the sodium will come inside. Okay, but there is a no hydrolyzing element not present in the neuromuscular junction. The succinylcholine is hydrolyzed by pseudocholinesterase. But in neuromuscular junction, then acetylcholinesterase is present there. The pseudocholinesterase is present in plasma only. Okay. But in neuromuscular junction, there is a acetylcholinesterase. So there is a no hydrolyzation enzyme is not present in the neuromuscular junction. So it's produce persistent depolarization. That is it. Okay. That is the reason being the fasciculation. 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 Okay. During usage of succinylcholine, there is a passivation appears. Become why that happen? That is the reason being that persistent depolarization. Okay. After fasciculation, after sometimes that persistent depolarization is lead to sodium channel inactivation. Okay. So sodium channel inactivation, the sodium influx is absent. Okay, the sodium is not come inside. So sodium is absent. So sodium influx is absent. The decorrelation is also the absent. So there is a no communication between nerve and muscle. So it produce flaccid muscle relaxation. That is a first phase. Left is a phase on block. Okay, the phase on block, the mechanism action is nothing but when give a succinylcholine, it produces depolarization. The sodium comes inside. That is called the depolarization. Due to the absence of hydrolyzation enzymes in the neuromuscular junction of succinylcholine, it produces persistent depolarization. That is the reason of vasodilation. After some signs, because of the persistent depolarization, the sodium channel become inactivation. So sodium influx is absent. So it's due to it leads to absent in it leads to uh, it leads to block the communication between the nerves and the muscles, which leads to pleasant muscle relaxation. That is a phase one block. Now we learn about the phase two block. Okay, so phase two block. So this is a neuromuscular junction. So when the phase two block is happen, the subs are given more than 5 mg per kg or continuous nutrition. That is the overdose. So when given succinylcholine product as a overdose, the phase two block is happened. Okay. So that's why from inside the same physiologies happen. After some time, the sodium channel become inactivated. Then the cold receptor also get desensitization. Desensitization means even it cannot be act on acetylcholine receptor, acetylcholine also. So there is a normal physiology also didn't happen in this space one block. The after some times after 10 minutes, the succinylcholine goes to the plasma and hydrolysis by pseudopolyester, and the normal physiology also come back. The acetylcholine bite and normal physiology will happen. But in the case to block the whole acetylcholine receptor, acetylcholine nicotinic receptor is desensitized. That is called, the another name is called desensitization block. Okay. Desensitization block. Okay. So the whole receptor is desensitization. That is a very dangerous compared to phase one block. So it cannot act as acetylcholine. So the normal physiology the coming back to the normal physiology is very difficult in this situation. So that is a is to block. So this is a two different way of blocking of neuromuscular junction and produce the muscle relaxation. And next we will discuss about the what non-depolarizing muscle relaxants between neuromuscular junction. Okay. So non-depolarizing muscle relaxants. So all type of non-depolarizing muscle relaxant have a same mechanism of action, that is um, competitive antagonist. So this is a nerve terminal and the muscle implant. Then is a receptor, acetylcholine receptor. Okay. The non-depolarizing muscle relaxants command by and the blocks the communication between the nerve and muscles. So it's common pile and eat waste or do nothing right there. Okay. Do nothing. So there is a no communication between the nerve and the muscle. So the muscle relaxation is happened. So all type of non-depolarizing muscle relaxants uh, give us same way of mechanism action to produce muscle relaxation. Okay. But now we discuss about how non-depolarizing muscle relaxation reversed. So we have a reversal agent. So classical example of reversal agent is neostigmine and the Sugammadex also. And Neostigmine and Sugammadex have a unique different types of mechanism action to reverse the muscle relaxation. First, Neostigmine. During the muscle relaxation, they when give a neostigmine to reverse the muscle relaxation, the neostigmine, I already told it's a anti-acetylcholine esterase. The acetylcholine esterase is the opposite party of acetylcholine. So the anti-acetylcholine is friend of the acetylcholines. Okay, that is the enemy of the acetylcholine. Acetylcholine first I did told you. Okay, the acetylcholine esterase is present in this neuromuscular junction. That is hydrolyzed by acetylcholine. Okay, that neostigmine is the anti-acetylcholine esterase. That means the enemy of this. Okay, the enemy of this tension. So it is the friend of the water acetylcholine. Okay. The neostigmine is the friend of the acetylcholine. Okay, I told neostigmine and acetylcholine is a friend. Okay, acetylcholine and those are friends. Okay, acetylcholine plus acetylcholine esterase is electric. It's more the Tamil Nadu politics. Okay, and okay, so the acetylcholine esterase and the neostigmine also the friend. Okay. Now you will learn understand. Okay. So due to the anti-acetylcholine stress, the availability of increase of acetylcholine is increased. Okay. The acetylcholine is increased. That is acetylcholine. Okay. Acetylcholine is increased. Due to the increase of acetylcholine, it removes the non-depolarizing muscle relaxants and the produce the non-surgery happens. The acetylcholine enters the depolarization, then the muscle contraction is happen. So when the reverse, the reverse of this happened. Okay, that is the mechanism action of neostigmine. The Sugammadex, what will do the Sugammadex? The Sugammadex is a policeman with this type of weapons. Okay, the non-depolarizing muscle relaxation. This is the engulf the whole non-depolarizing muscle relaxation engulfed by Sugammadex and remove from the neuromuscular junction. So the non-physiology happen. That's how the reversal agent reverse the muscle relaxation, especially non-depolarizing muscle relaxants. The hope you will understand this all concept. We will discuss about another beautiful and important topic. Until that side of Chiriasa, this is Paramedico Chalasis.